Good afternoon. We are studying about the different areas of public health. We have already seen about the community health and global health. So this is family health. Okay. So in public health, the role of family is very, very important. Family is something that is the basic component of society. You would have studied right from first year about the family and how the family plays a role in society. So we should know what a family is. The definition of family is that it's a group of biologically related people living together and sharing the common kitchen and purse. That means it is either two or more people. It could be a husband and wife or more people who are living together and they have a common kitchen where they cook together and they share the income and expenses. Okay, so a family can be formed by birth or by marriage or adoption or by living together. That's called cohabitation. So this is what family is. So let us see the other aspects about the family. The family is a unit of service in all healthcare delivery. So in every healthcare delivery system, the family forms a unit. The health of one family member affects the welfare of other members in the family. If one person is sick, the other people take care of the sick person. So everybody is involved in the sickness. If one person becomes sick, all the others also get involved and their lifestyle keeps changing. And each family has their own traditions, customs and beliefs, and this plays a role in the health of the individuals and the family. Okay, and family is also important because it is part of the community health. So families only decide on how the community functions and how community has health care. So individuals and their health affects the family and its health affects the community. So that is how it is. So the smallest unit is the individual and the next biggest unit is the family and the bigger unit is the community. So one sick person or one unhealthy person can affect the whole community because the family gets involved and then the community gets involved. So that is something that is very basic that we should understand. So let us see about family health. We saw the definition of family. What is family health? It is a state of positive interaction between family members which enables each member of the family to enjoy optimum physical, mental, social and spiritual well-being. See, when a family has good health, that means they are physically well, mentally well, socially well and spiritually well. So all these four aspects, they have good status. That means they are physically and mentally, socially, spiritually healthy, and so the whole family is healthy. So this is very important. And a good family, an organized family will have usually a good positive health. If the family has problems, then it can lead to sickness. Let us see what are the functions of the family. The first function is socialization of the family members. In the first year, you would have studied that family plays a major role in socialization. What is socialization? When a child is born, the child is taught how to behave with other family members. The child is taught how to behave with other elders from outside the family. And in the school also, the child is taught socialization. Okay, so family is the first unit which starts the socialization process for its members. And so family also helps in economic stability. See, if there are people earning in the family, then it brings stability to the family. Family meets the sexual needs of people. Family takes care of dependent members. See, old people who are not having an income and young children, who are not working, so they are dependent members. So the people who earn money, they take care of the dependent members. Then the family provides emotional support for members whenever they have troubles or they are emotionally having problems. Then family also satisfies social, intellectual, emotional and psychological needs of the members. It teaches the children rules for behavior. I already told about socialization, and it teaches the children rules about behavior and how they have to be conducting themselves. And it provides members with a sense of family identification. So each of you belong to a family, so that sense of belonging gives you a certain amount of pride, and at least you belong somewhere. Just imagine if there is somebody with no parents, how they will feel. So that actually makes them suffer. So each family, even they will want to find out who their parents were and identify themselves, even the people who don't have parents. So the family itself, whether there are living members or non-living members, it gives a sense of identity to the individual. And then the role of family in sickness is that it provides interaction among family members during health, disease, and also provides counseling and rehabilitation. What are the determinants of family health? Living and working conditions, physical environment, psychosocial environment, education and economic factors, health practices, cultural factors, gender. So all these are determinants of family health. So if a family has to be healthy, then the living and working conditions are important. The family has to have enough space for each person. They should not live in overcrowded conditions, and they should have good occupational health. That is, the members of the family who are working should have good occupational health. They should work in areas where it is less risky for their health. The physical and psychosocial environment in which they live plays a role on their health. If they live in a area where there is a lot of cold climate or very hot climate, then it can affect their health indirectly. Okay, that is why the physical environment is important. Education and economic factors are very important. You would have studied in your second year about the determinants of health. There we have studied about education, economic factors. And then in this year in medical sociology 2, you have studied about how cultural factors and health practices play a role in the healthcare of individuals and communities. So the same factors play a role in the family's health also, because each family is part of a culture, and each culture has different practices of healthcare. So it indirectly affects the family's health, or sometimes even directly affects the family's health. Then we'll see about the scope and components of family health. Okay, what are the problems faced in families? Broken homes, drug abuse, juvenile delinquency, disability, unmarried mothers, teenage pregnancy. These are seen. Maybe some of them are not seen in many families, but things like disability and rehabilitation and all, when people become sick, it affects any family. But there are some other families where children may have teenage pregnancy, unmarried mothers may be there. So all these are problems faced by the family. Then other areas of family health are the reproductive health. Every family, the reason for a family to be present is to procreate. That is one definition of family. Okay, so every family will have a time when the women have children. So one of the most important aspects is safe motherhood, antenatal care, delivery care, postnatal care. Then family planning if they are not planning to have any more children. And nutritional deficiencies can occur during pregnancy for the mother or child after the birth. Then low birth weight in the child. These are some common problems. Then there are other issues which are related to reproductive health, which include sexually transmitted infections, HIV/AIDS, abortions, infertility. So these are some problems associated with reproductive health. And then adolescent health is also important, because that is part of the reproductive health. Then the other aspect of family health is the child health. So the children are very important in any family, and they can suffer from nutrition. They should have correct immunization at the right time. Their growth has to be monitored. Childhood mortality and morbidity is very high in developing countries. Children will have social problems. So all this have to be taken care of by the family. And if in some families we can see battered baby syndrome. Battered baby syndrome means the parents are not able to take care of the child, and they start abusing physically the child. They start hitting the child, and the child will not be able to tell others if it's very young. Even if it's older, the child may not tell other people. and usually it's in babies. Battered baby syndrome is in babies, and we can see that the child has some fractures which have healed on its own. So these are all symptoms of battered baby syndrome because of the parents hitting the child because they are not able to take care of the child or because of their emotional problems. The next aspect of family health is the gender issues in the family, how the males and the females are treated. There are certain stereotypes in the family. That is, women means they have to be treated like this. They have to cook. They have to do these activities. Men means they have to do these activities. So these are all gender issues in the family. Then the last part is the aging and mental health. There are various problems in aging, and mental health problems are present. These are also part of family health. Okay, and the role of a family in health is there, and the responsibility of a family in health, they are based on what a family does in different areas of life. So responsibilities of family include child rearing, that is helping in the growth of the child, socialization process, personality formation, care of dependent adults. Any old people who become disabled or bedridden, they have to be taken care of, and other even normal, I mean young women during pregnancy or childbirth, they can become dependent. Aged people, or if there is a handicapped person in the family, they can become dependent. Young children are dependent. So all these people have to be taken care of by the family. And stabilization of adult personality, family susceptibility to diseases. See, these days coronavirus is common, so it helps us to understand the importance of health and what are the practices that we follow. Everybody, if you go out without wearing a mask, your mother will tell you wear the mask, or your father will tell you wear the mask. Or as a student, if your father goes to work without wearing a mask, you may tell your father, please wear a mask and go, because you may catch the infection. So this is how the family is susceptible to disease and helps each other to by being responsible and trying to prevent diseases from entering the family. And in case of broken families or problem families also, there are people who have some responsibilities towards other members. Then responsible parenthood is a very important aspect, and there are certain responsibilities of every parents. They have to involve in the process of socialization of the children, because that also plays a role in healthcare, and they have to put the needs of the child over the self. So if there is only little food, they have to give food to the child before they are able to eat, because that is how families are. And the parenting may be influenced by the class of the person, the economic status, education. Parenting styles may be authoritarian, that is rigid and strict, or authoritative where positive reinforcement is there, permissive where there's a lot of freedom and autonomy given, or it can be uninvolved where physically, emotionally and non-supportive parents are there. So the parenting plays a major role in the birth and growth of the child. That is why we study it as part of the public health, and it plays a major role in the health of the family. Okay, we have already studied about parenting, so I'm just going to skip this area. Finally, parenting education. Okay, a parent has to be educated about the healthcare of the children, so that they are able to bring up children in the proper way. The children should be happy, healthy and well behaved. Okay, they should be happy, healthy and well behaved. If they have to be happy, healthy and well behaved, then the parents have to do a lot of role modeling and take care of the children. Then only the children will grow up to be successful people. Okay, so this is very important. And a parenting education program can be given to parents where they learn skills on how to parent. See, some of the things that can destroy the confidence of a child is comparing the child with other people, your neighbors or their own sisters or brothers. Okay, that will make them less confident. So these are some of the things that are taught during the parent education program. So how a parent has to bring up the child is taught to the parents, and this has a very major role in the health of the family, because if the child is brought up properly, then they will not involve in juvenile delinquency, they will not involve in drugs, they will not involve in other negative influences which can cause health problems, and the family can be a happy, healthy unit. So this is why the family, especially the parents, have a major role in bringing up the child, and that will help in maintaining good health in the family. Okay, so with this we have finished almost all parts of disaster management. This is the family health in the area of public health. We have also seen the other video about the global health and community health in the area of public health. So the last topic that is pending, which we will see in the next class, is environmental and occupational health and epidemics. Okay, so with that we'll be finishing disaster chapter. Thank you.